Welcome to your annual compliance program training. As a reminder, following the training, you will need to complete an annual acknowledgement attesting to the fact that you not only completed the training, but that you received the compliance program and understand that you have to follow the compliance program as a condition of employment. Additionally, you will also need to complete a post-test that reviews the material that we went over today. Both of these documents should be turned into your compliance liaison, so we have proof that you've completed the annual compliance program training. Today, we will be going over why a compliance program is needed. We'll be reviewing Legacy's compliance program. We'll talk about ethics, regulatory focus areas, and then we will wrap up with ways to promote compliance and reporting. A little bit of background about why compliance programs are needed. So from the federal regulations, we have FTAG 895, which requires long-term care facilities to implement a compliance and ethics program. The effective date for this regulation was November 28, 2019, but there was a proposal to postpone enforcement until November 28th of 2020. So in the near future, surveyors will be looking at compliance and ethics programs as a condition of participation during the survey process. So it's very important that all levels of staff understand the compliance program and could answer questions about it during the survey process. The purpose of this requirement is to design and implement a program that will be effective in preventing and detecting criminal, civil, and administrative violations. The whole purpose of a compliance program is to be proactive through availability of a hotline, providing ongoing training, and internal auditing and monitoring. Also, all Legacy employees who are employed by the management company also receive this training so that not only are they aware of what the compliance program requirement is for the skilled nursing facilities they support, but they also have to follow the same regulations as a management company to skilled nursing facilities. Legacy's compliance program is built on 7 elements. These 7 elements come from guidance from the Office of the Inspector General. The Office of the Inspector General is an agency within the Department of Health and Human Services that is responsible for investigating fraud, waste, and abuse and making recommendations to other agencies within the Department of Health and Human Services related to increasing oversight, enforcement, and changing regulations. The guidance from the OIG covers these 7 elements, and the idea behind it is that if a company effectively implements any of these or all of these elements, then there would be less likely to commit fraud, waste, or abuse against the Medicare, Medicaid programs, or other government programs. The first element is implementing written policies, procedures, and standards of conduct. The second element is designating a compliance officer and compliance committee. The third element is conducting effective training and education. Fourth, developing effective lines of communication. Fifth, enforcing standards through well-publicized disciplinary guidelines. 6th, conducting internal auditing and monitoring. And then 7th, responding promptly to detected offenses and developing corrective action plans when necessary. So this is a diagram about how Legacy's compliance program is set up based on those 7 elements. So at the top, you have your oversight function, which is comprised of the compliance committee, which is a Legacy level committee, your compliance officer, who is Alice Oshinsky, your compliance liaison, who is a facility-based individual that Alice relies on to implement elements of the compliance program. And then at the top of the organization, you have your governing body. At the center of this diagram, we have the documents that are written standards to help support the compliance program. So you not only have your compliance plan, which you should have received either upon rollout in 2018 or upon hire thereafter, and also compliance policies. For the prevention systems, we have preventative auditing and monitoring, education, and the hotline. And now we'll go into each of these in a little bit more detail. So starting with your written standards, you have a compliance plan, which is reviewed on an annual basis by Alice Oshinsky to determine if there's anything that needs to be updated in the compliance plan based on new systems that the company has implemented or changes in the regulation or new enforcement priorities that we want to make sure that everybody is aware of. This year, the compliance plan was only slightly modified to remove the requirement for a compliance committee at the skilled nursing facility level. Instead, the compliance committee is a Legacy level committee and each skilled nursing facility is not required to separately have a compliance committee that meets on a monthly basis. Legacy employees will receive a copy of the compliance plan, and the skilled nursing facilities will also receive a copy of the compliance plan. Again, this was originally rolled out in 2018, so you either should have received it then if you were already employed by the company or at the time of hire thereafter. And we will provide you with notices of updates on an annual basis. Additionally, you are required to sign an annual acknowledgement that demonstrates that you've received the compliance plan, you've participated in annual training, and you understand that following the compliance plan is a condition of employment. The individuals designated to oversee the compliance program are 4 different distinct people or groups of people. At the top of the organization, you have the governing body. For skilled nursing facilities, the governing body is composed of your administrator, your DON, your medical director, and your RDO. And this group of individuals is responsible for making decisions on behalf of the facility to ensure compliance with state and federal regulations, to mitigate risk, and ensure that the compliance program is effective. Alice, as a compliance officer, is responsible for helping the facility with doing that by developing policies, putting out education, keeping up to date with regulations, and then communicating that information to the facility-based compliance liaison, who will then implement new policies at the facility level, ensure that appropriate individuals receive training or regulatory updates, and also to help Alice with auditing new systems that have been implemented. For example, if we roll out a HIPAA training, then the compliance liaison would be responsible for ensuring that all staff receive the compliance training or the HIPAA training, and then reporting back to Alice so she can document that each of the legacy contracted skilled nursing facilities have met their compliance requirements. And then finally, at the legacy level, you have a compliance committee. This committee is made up of different individuals from different departments, such as clinical, operations, and HR, with Alice as the compliance officer serving as the chair. On a quarterly basis, this compliance committee meets to review trends from within the organization, and those trends are reviewed to identify opportunities for improvement, such as providing education, increasing oversight or auditing in a specific area if there's concerns about performance, or changing policies and procedures so that they be more clear or more effective going forward. For training and education, all legacy employees and all skilled nursing facility employees are required to participate in annual compliance training. This is one of many required trainings on an annual basis. We also conduct HIPAA training on an annual basis, and then there are a number of required trainings at the skilled nursing facility level that you will also be receiving. Additional trainings will be conducted periodically to ensure that all legacy employees and skilled nursing employees receive enough education to perform their duties in compliance with the laws, regulations, best practices, and company policies. So just as a reminder, following this training, you will be required to complete the post-test to demonstrate that you have participated in today's training and understand the content that was presented to you. Internal compliance auditing and monitoring is one of the key functions of the compliance program. As I mentioned previously, the purpose of a compliance program is to be proactive and not rely on the government to identify any wrongdoing. The government does not have enough resources to audit every healthcare organization on an annual basis. Therefore, they rely on healthcare organizations implementing internal auditing and monitoring and reporting any wrongdoing or improving their systems on a proactive basis. So on an annual basis, we will be looking at developing a risk assessment that identifies different topics within the skilled nursing industry that we believe to be high risk for enforcement or penalties. And then we will be assessing that risk by providing a copy of the risk assessment to each skilled nursing facility to complete. The reason that we do this on a facility by facility basis is because not every facility has the same level of risk. Some facilities might be exposed to more risk with Medicare Part A if they have higher Medicare Part A censuses. Other facilities could have concerns related to behavior management, psychotropic drug use, falls, or perhaps even HIPAA if they've experienced a significant breach in the last year. So the risk assessment is our way for identifying appropriate use of resources, both from the facility and legacy, to identify opportunities for audits and conducting performance improvement projects at the facility level to improve systems, to change policies, identify training needs, and then demonstrate improvement over a long time. So there will be monitoring going forward to make sure whatever outcomes from audits that results in corrective actions or changes to policies are effective, so that over time we can reduce our risk exposure by improving systems. Compliance program communication is largely the responsibility of your compliance officer. So it's important that all staff at the facility be familiar with who your compliance officer is, which I'll repeat again, that is Alice Oshinsky, and also who your compliance liaison is. Both the compliance liaison and compliance officer need to be accessible and known to all employees. Communication of guidance on compliance issues, as well as updates on regulatory and enforcement issues, will come from Alice on a monthly basis to your compliance liaisons, who will then be responsible for sharing that information with relevant employees. And then the final mechanism for communication is having the availability of reporting mechanisms, one of which is the hotline. So in a little bit more detail, here's your hotline number on this slide. All employees are responsible for monitoring and reporting compliance activities that violate or appear to violate any applicable statute, regulation, policies, or the compliance plan. Employees who become aware of a violation of the compliance plan must report that violation to their supervisor, the compliance officer, the compliance liaison, or to the compliance hotline. So there are many different mechanisms for reporting. So for not reporting, there is no excuse. The compliance hotline is hosted by a third party called Lighthouse. You should have posters throughout your facility. The hotline is available 24/7. It is staffed by a representative of Lighthouse. They have a series of questions to ask to ensure that they get enough information to pass on to Legacy so that an efficient and thorough investigation can be conducted. Reports can be made anonymously. You do not need to identify yourself or provide contact information. However, if you do report anonymously, please remember to ensure that you leave enough information to allow a thorough investigation to be completed. If you were to call into the hotline and identify the name of your facility and just say that you have concerns or you think something inappropriate happened, that is not detailed enough for anyone to conduct a thorough follow-up. So it is important that you do provide enough detail for an investigation to be conducted when you leave messages anonymously. Alternatively, if you would like follow-up, you can leave your name and phone number. In addition, not only is the hotline available to employees, but the compliance hotline is also posted in areas that are accessible to the public and residents, so that residents and family members and other interested parties can also call into the hotline with any concerns that they have that cannot be resolved at the facility level. This is your whistleblower protection slide. There are federal and state laws that prohibit retaliation against employees who provide information that the employee believes is reasonable and is a violation of federal or state law. Therefore, if you make a report in good faith, then there cannot be retaliation taken against you for the act of reporting. Good faith means that the report is made honestly, the report is reasonable, and has no intention of revenge or other malintent. So you are doing this because you think it is in the best interest of the facility or the patients that you serve, and you're not making up false complaints just to get an employee in trouble because you don't like them. False complaints can be subject to disciplinary action. However, good faith complaints are not subject to disciplinary action. However, if you do participate in the bad behavior you are reporting, then you can be disciplined for your participation in the behavior that resulted in a violation of the regulation. You would not be disciplined for the act of reporting itself. It is really important to Legacy that we have transparency and open communication within the organization. When there are concerns, we want to be aware of them so that we can follow up and investigate those concerns and take whatever corrective actions are necessary and make mandatory reports as indicated. So we really encourage open communication and transparency. Hence, we have the ability to report anonymously if you have any concerns about leaving your name or identifying yourself. The last of the 7 elements for the compliance program is enforcement. An effective compliance program has to have clearly communicated standards that deter non-compliance. So you can't just have compliance as paper that sits on a shelf with annual training, but there has to be consequences for violating the compliance program, policies, committing illegal or unethical behavior. Decisions about disciplinary action and corrective actions need to account for the severity of the action taken by the employee, be consistent for all employees, be documented, and be strong enough to deter future recurrence. So the punishment does have to fit the crime. For more severe violations, those may result in termination, whereas lesser significant violations could result in a change to the policy company-wide, some education or one-on-one training with an individual. Depending on the type of noncompliance, legacy employees may be involved in assisting administrators with determining appropriate disciplinary actions for non-routine matters that involve violations of state or federal regulations. But largely disciplinary action at the facility level will be left up to the discretion of the administrator. This is your first recap exercise. This will be documented on your post-test so you can refer back to the training. You will need to identify who the compliance officer is, who your facility compliance liaison is, what the F-tag is for the compliance and ethics program, and then finally, you will have to identify at least one location where the hotline poster is located within your facility. And again, you will document the answers to these questions on your post-test. Moving away from how compliance is implemented by Legacy and its skilled nursing facilities, we'll now spend a few minutes on talking about ethics. Ethics is a system of moral principles. They affect how people make decisions and lead their lives. Ethics is concerned with what is good for individuals and society and is also described as a moral philosophy. The difference between compliance and ethics is largely that compliance is following the law. However, the law is not always clear. The law might have prohibitions against certain actions, but not speak to the other 100 circumstances that could possibly come up. So when the law does not specifically give you direction, you use your ethics to make good decisions that you believe follow the intent of the law and are in the best interest of both the company and the patients that you serve. An ethical issue is when you have to judge what is right and wrong, when you have to choose between two options, especially when there are pros and cons to each choice, deciding whether to do something or to do nothing, and then weighing the potential impact of your decisions or actions. Ethics is an important topic to discuss as part of the compliance program because even if we provide this training on an annual basis and we have paper compliance in the form of policies and the compliance plan and training records, the compliance program will not be effective if people don't do the right thing. And so we want to encourage ethical decision making and walking the walk, talking the talk at the facility level and really implementing what we train you on an annual basis so that there is a less likelihood that there will be fraud, waste, or abuse committed against the federal government and that there will not be any violations of state or federal laws. One way in which we apply ethics is ensuring that we do not have conflicts of interest or that we manage those conflicts of interest when they occur. One potential conflict of interest that we will be focusing on this year is identifying your personal values and separating those from the values or interests of your employer, particularly when it comes to political contributions. It is important to distinguish between your personal beliefs and statements and representations you make on behalf of Legacy. Employees are not allowed to use company funds or Legacy's name, including the fact that you are an employee of Legacy, without approval by the governing body. And just a reminder, the governing body for Legacy SNF is the administrator, RDO, DON, and medical director. In addition to getting the approval of the governing body, facilities must ensure that their employees also get the approval of the Chief Operating Officer for the West Division, who would be Shai, or the Chief Personnel Officer in Government Affairs for Illinois facilities, which would be Jamie. So both Jamie and Shai and the governing body need to sign off for any employee to use company funds and use Legacy's name when making political contributions or statements. Alternatively, employees may use their personal funds for political contributions, but they should not be representing their affiliation with Legacy as part of any political contribution or statement. So you can make contributions personally, but you're not going to identify yourself as a representative of Legacy by identifying your employment with Legacy as part of that political contribution. Now we'll be moving into regulatory focus areas. This slide shows the difference between fraud, waste, and abuse. These are terms that we commonly hear of in the healthcare industry, and they have distinct definitions which are provided on this slide. I've also provided examples of how each one may come to fruition so you can understand the difference between fraud, waste, and abuse. The main difference I'd like to point out is that fraud requires some knowledge or intent behind the action, whereas waste and abuse can occur just by taking advantage of a system or exploiting a loophole without purposely submitting something fraudulent. Civil monetary penalties law allows the government to levy penalties against providers or individuals that violate certain regulations. Some examples are provided on this slide. For example, making false claims or paying to influence referrals from healthcare providers. Those would be actions that violate federal regulations that would result in civil monetary penalties. Penalties can range from around $15,000 to $70,000 per violation, depending on the specific regulation that was violated. Violators can also be subject to paying 3 times the amount that they bill to the Medicare and Medicaid program. And this is important because the government uses civil monetary penalties to punish bad actors and then reinvest that money in enforcement opportunities and grants for good actors. For example, the HEAT program, which is a Medicare fraud enforcement unit, is funded through civil monetary penalties. So the government repurposes the penalties from bad actors who have violated the law to help with enforcement in the future. So assessing these penalties is useful for the government. So one, not only does it hopefully deter the bad action from recurring, but also it helps the government with its enforcement opportunities in the future. One of the major regulations that the federal government uses to punish criminals is the False Claims Act. The False Claims Act makes it illegal for any person to knowingly present or cause to be presented false or fraudulent claims for payment or approval, or knowingly using false records or statements to support a fraudulent claim. Penalties for violation are adjusted for inflation on an annual basis. Currently, the penalties are a minimum of $11,181 up to a maximum of $22,363 plus treble damages. This means that if you make false documentation and you submit that claim for payment by the federal government, then not only do you pay back 3 times what you originally billed, but you could also pay a penalty of $22,000 on top of that. The reason that the government has such high penalties is to deter individuals from committing fraud in the first place. It's not that you just repay whatever money you stole, but you're paying back 3 times what you stole, plus a penalty of up to $22,363 per claim that was inappropriately billed. This is the government's way of deterring wrongdoing. Getting a little bit more into detail on the definition of knowingly under the regulation, what does that actually mean? The first category of knowledge would be that you actually know that you are submitting a false claim at the time you submit it. So if I made up a false record or a false physician order and forged a signature and then billed for a service, that would be actual knowledge. I know what I'm submitting for payment is false and fraudulent at the outset. The second category is deliberate ignorance. So deliberate ignorance would be when you identify that there's a potential problem. Maybe there's unusual billing patterns. Maybe what you are billing this month is significantly higher than you billed last month. Maybe you're concerned based on statements that have been made by other people, but you don't have actual knowledge. So when you have a gut feeling that something inappropriate has occurred and it might impact billing to the federal government, which means Medicare or Medicaid claims, and you fail to do something at that point by looking into it and conducting an investigation, that would be deliberate ignorance. The government's expectation is when you have a concern that you conduct an investigation or audit to identify if there's a real violation of regulation. If there's not, then that's great, but at least you did your due diligence. So deliberate ignorance would be ignoring those red flags or ignoring your gut saying, wow, I think we did something inappropriate that would be a violation of law, and just saying, we'll see what the government says if they come back to us. That would be an example of deliberate ignorance. The third category is reckless disregard. Reckless disregard would be the equivalent of conducting an audit at the facility, identifying that there was fraudulent claims submitted. For example, maybe you did not have physician orders for certain services you billed for and provided, and then you identify that. And it's not just a suspicion, but you have actual knowledge now that you mistakenly billed for something that was inappropriate and should not have been refunded or should not have been paid by the government. If you fail to refund that money and to do an investigation into that concern, then that would be reckless disregard. It's one step above deliberate ignorance. It's not just a suspicion. At this point, you have actual knowledge and you failed to act appropriately to refund that money to the government. So you do not need to know at the time that you were submitting a false claim, but if at a later date you become suspicious or aware that a false claim was submitted, you are also required to act under the regulation, and failure to act can mean you are liable for those penalties from the previous slide. Per the Yates memo, which was issued by Deputy Attorney General Sally Yates to other attorney generals within the federal and state systems, the government should be pursuing individual liability, which is the equivalent of individual accountability, when there's evidence that an individual was aware of wrongdoing and either condoned or turned a blind eye, regardless of that individual's ability to pay. What this means is that the government is set out to hold individuals accountable. Not only would they go after the company that committed the false claims violation, but they would do an investigation to determine whether or not anyone at the company had knowledge that false claims were being submitted or should have had knowledge through the exercise of internal audits and reasonable diligence, been able to identify that false claims were being submitted. And if they're able to identify that someone did have knowledge and failed to act, then that individual can personally be held liable under the regulation for paying penalties because they were in a position to bring this to the government's attention proactively and they failed to do so. When there is an overpayment that is identified, you have 60 days to return that overpayment. If you fail to return an overpayment after 60 days, and you keep the money from the government that you know the company is not entitled to, that would be considered stealing. And the government does not like to work with companies that steal from them, and so that would also trigger liability under the False Claims Act. So if you do identify errors in payment by the Medicare administrative contractor, you do need to return that money within 60 days, so you do not have liability under the False Claims Act. The next statute we'll be discussing is the anti-kickback statute. Federal law prohibits the knowingly and willful offer, solicitation, or receipt of any form of kickback, which includes anything of value in cash or in-kind items. So this could be a gift card, this could be receiving an iPad, personal gifts, tickets to an event. So all of those could be examples of kickbacks in exchange for the referral of healthcare business paid for by the federal government. So that includes Medicare and Medicaid. At the facility level, there's two ways that this plays out. The facility is in a position to receive referrals from hospitals and physicians. So the facility needs to be mindful about the way it interacts with its referral sources. For example, it would be illegal for the administrator or hospital liaison at the facility to give personal gifts to physicians in order to get them to refer patients to your facility, because the government wants to make sure that healthcare referrals are made based on patient choice and quality. The goal of these regulations is to ensure that healthcare recommendations are ethical and made in the best interest of the resident based on their choice and their needs, and not as a result of an inducement. So you can't bribe someone to get referrals. The facilities that have the best quality and are best suited for the patient's needs should be getting the referrals, not the patients with the highest marketing budget. On the other side, you do also have certain individuals within the facility that are in the position to make healthcare referrals to other healthcare agencies or companies that will bill the federal government. For example, pharmacy, rehab, DME, lab, home health, and hospice are all vendors and other healthcare companies that provide services at the behest of the skilled nursing facility and then subsequently bill the federal government for their services. For example, it would be illegal for your administrator to receive a Rolex watch from a pharmaceutical company who is trying to get a contract with your building. If the administrator receives that Rolex and says, great, thank you, I will sign a contract with you and use you instead of who we currently have, that would be illegal because that Rolex would be an inducement and a violation of this regulation in order to get healthcare business by exchanging gifts. It is both the party who gives the item of value and the party who receives the item of value who is liable under this statute. So this regulation is implicated, again, if the service being provided is going to be billed to Medicare or Medicaid, and the individual knows that providing the gift is likely to induce referrals. As long as one purpose of the exchange, it doesn't have to be the sole or only purpose, as long as one purpose of the exchange is to get business that will be billed to the federal government, you have to be extra careful about what you give and receive that might influence healthcare referrals. Both parties can be liable and they can pay penalties under these regulations. Penalties for violation of the anti-kickback statute include $25,000 per exchange of item of value to induce a referral, imprisonment for up to 5 years in federal prison, and exclusion from participating in healthcare programs. Exclusion means that you would be put on a list of individuals who cannot work for a company or directly bill the Medicare or Medicaid programs. So if, for example, you were on the exclusion list, you would not be able to work for a skilled nursing facility because the employer bills Medicare and Medicaid. So it's really important that you are mindful of what you give and receive from your referral sources, and that if you are an individual that is in a position to refer healthcare business, for example, social services and their interactions with home health and hospice agencies, you have to be very careful about the transactions between yourself and those home health and hospice agencies. We're not concerned about everything. There's a lot of gray area under these regulations. Receiving pens that are branded or hand sanitizers, a low-cost meal if an in-service is being provided. If an in-service is being provided and someone brings in a tray of cookies that's distributed among staff, those are all acceptable practices that we do not believe are likely to induce referrals. However, we would be much more concerned with personal gifts being given to decision makers who could refer business. So there is a lot of gray area, again, in this regulation. If you have any questions, please reach out to your compliance liaison or the compliance officer for additional guidance. This is your second exercise to test the knowledge from the preceding slides related to fraud, waste, and abuse regulation. So on your post test, you will be matching the items in column 1 with the items of column 2. So you will indicate which of the letters you believe matches with each of the numbers. And you will complete this after the training as part of your post test. To wrap up today's presentation, we'll be talking about ways to promote compliance. So as an employee of a skilled nursing facility, you are responsible for understanding and abiding by the compliance plan, attending annual compliance program training and any other risk area specific training as required by your job responsibilities, adhere to the compliance plan and policies as they apply to your job function, assist with internal audits and investigations as necessary. You might be asked to do internal audits within your department or to assist the compliance liaison with a hotline investigation. And then finally, report any suspected compliance issues either to your compliance liaison, the compliance officer, or via the compliance hotline. To help prevent fraud, waste, and abuse, you also can keep your eyes peeled for potential violations. First, remember that you do have to comply with regulatory and Medicare requirements, including ensuring that this compliance program is effective at the facility level, You do have a duty to report compliance concerns and a duty to follow the code of conduct, which is outlined within your compliance program. So things you should be looking for: suspicious activity, making sure that you conduct yourself in an ethical manner, ensuring accurate and timely data for billing, ensure that you coordinate with other payers and follow their rules for payment, keep up to date with guidance related to fraud, waste, and abuse policies and procedures, standards of conduct, laws, regulations, and CMS guidance, and then verify all information provided to you. So that concludes today's training. My email is there at the bottom, pagepennington@compliagent.com. Then you also have Alice Lashinsky's email at Legacy, who again is your compliance officer. If you have any questions, you can contact either of us. You can also reach out to your compliance liaison for additional information. Please remember to complete your annual acknowledgement and your post-test following today's training so that you get credit for participating in annual compliance training. Thank you.